Do you have type 2 diabetes and are frustrated with waking up with high blood sugars? If yes, the answer could be hidden in your sleep, literally. How? Because good sleep quality is important for good health and specifically for better metabolic health and type 2 diabetes. Hi, I'm Dr. Soham Patel, a board certified endocrinologist and lifestyle medicine physician, and your host in this mini video series on type 2 diabetes. If you haven't checked out my previous videos, please check out those videos. The description has the links of those videos. So, on to the connection between type 2 diabetes and sleep. You see, our body is connected to our exposure to sunlight. When we wake up in the morning, we get sunlight, and then at night we don't get sunlight. So in response to the sleep-wake cycle and the sunlight exposure, our hormone levels are different. We call it circadian rhythm. You may have heard the term. If not, you heard it just now. So when we go to sleep, when we wake up in the morning, we get sunlight exposure, and then more so in the middle part of the day, and that actually stimulates good release of a very important chemical called melatonin in the body. Melatonin is important for many things, but specifically for getting us good deep sleep. So in the first half of the sleep, normally our hormone levels go down, most of those. So cortisol, which is a stress hormone, goes down, insulin goes down, and our sugar normalizes. And then in the second half of the sleep, cortisol goes up, insulin starts going up, and the sugar also starts going up. Now, for some people, this increase in cortisol in the morning is quite pronounced, and hence the increase in sugar is also pronounced, and that we call it as dawn phenomenon. And that is one of the reasons why people with diabetes, find themselves waking up with higher blood sugars in the morning. But that is not the most common scenario. The most common scenario I find is actually not good sleep. So when you do not get good sleep, the drop in the cortisol, in the stress hormones and insulin level that should happen in the first half of the sleep does not happen. So your sugar stays high because your cortisol and your insulin stays high. You stay insulin resistant throughout the night. And so you wake up with 50 to 100 points higher blood sugar than you went to sleep with. And it's even more frustrating and bewildering for patients because they did not eat in the middle of the night and they still wake up with higher blood sugars. So getting good sleep is very important because that connects to better metabolic health, better blood sugars, and that much improvement in type 2 diabetes. So much so that like we talked about chronic stress last video and how it can single-handedly undo the benefits of good food and activity, same way not getting good sleep can single-handedly undo the benefits of good food and activity. Secondly, the quality of sleep and the time of onset of sleep is even more important than the duration of sleep. Now, don't get me wrong, we all need 6 to 8 hours of sleep. And everybody has a different sweet spot. Someone needs 6 hours, someone needs 7, someone needs 8 hours. But the evidence is somewhere between 6 to 8 hours. But when you're getting those hours of sleep, the quality and the time of onset becomes even more important. For example, you sleep 8 hours, but you're tossing and turning throughout those 8 hours, versus you get 6 hours of deep, good, relaxing sleep. Those 6 hours of deep sleep would be a lot better than the 8 hours of tossing and turning. Same way, if you get 8 hours of sleep, but you go to bed after midnight, versus you go to bed by 10:30 and you get 7-8 hours of sleep, the sleep quality that you would get and the circadian rhythm and the hormone flux levels would be better when you get to sleep by 10:30 versus same hours of sleep but going to bed or falling asleep after midnight. So it's important to focus on good beauty sleep, like they call it, and the quality of the sleep and the time of onset of the sleep is even more important than the quantity of the sleep. In my next video, I'll talk about what kind of mindset and approach we need to take as we embark on the journey of type 2 diabetes reversal. But till then, keep striving for health and better sleep. See you in the next video.